Hello, everybody. I'm Dr. Sunandini Bose. I thank the YOSI Ocular Emergency team for giving me this opportunity today to speak about corneal foreign body. So, to quickly look at the etiologies, high-risk occupations that are related to eye traumas are workers, welders, grinders, stonemasons, farmers, and workers who are working in the chemical industries. So, lack of protective eyewears and high-risk activities they increases the risk. Ocular foreign bodies have been classified into toxic and inert. In toxic, we have the most common form that is the iron or vegetable matter, and inert glass or stone are the most commonest forms of foreign bodies. So quickly, let's go through some case scenario. This was a small case where you can see this small particle that is stuck at the limbus. This was a 19-year-old male patient, and this is a post-removal picture. This was a 56-year-old female who was housewife by profession. You can see a small, foreign body stuck at the limbus. So this is a picture after removal of the foreign body with the forceps only. And this is a third patient where you can see a small iron particle that is stuck on the cornea, and this was removed with the help of a 26G needle. And this is a post-removal picture. And this is a last case where you can see a stone kind of or some grinding material that is stuck on the cornea. So the primary management, you have to understand that you have to make the patient first pain-free and then only examine the slit lamp because the patient will not be able to open the eye otherwise. You have to avoid any eye patches for the risk of infection and foreign body sensation, and you have to use an eye shield while the patient awaits. The foreign body should be removed within 24 hours, and thorough eye wash needs to be done. The eyelid needs to be averted to look for any conjunctival foreign body. So I'll just show you one case where how you can remove the foreign body can be seen. So this was a case where you can see this foreign body is there, and I'm just trying to remove it with the help of a 26G needle. You have to go oblique in these cases, and also you can use a 25, 27G needle also or a 30G needle also. Make sure you go oblique and not vertical so that you do not perforate the cornea or cause any iatrogenic traumas in this case. So here I'm just trying to remove the foreign body. You can see the foreign body has been removed in this case, and after removal of the foreign body, you can just check under higher magnification if there is anything left or not. And this is the another case where I will show you how to remove one foreign body, in a lamellar laceration case where it is a lamellar laceration within foreign body that is stuck into the cornea, and you can just use a limbs forceps or a one tooth forceps to remove this foreign body. Just take it out from the wound, and after removal you have to use this balanced solution and a flat brush, flat cannula to clean the crevices properly. You can see the foreign bodies that are coming out, and after removal of the foreign body you have to do a sheetal test to see whether the case was not having any leak. And over here I have just done with a cotton bud and see that there was some aqueous leak or not. So coming to the further management, you have to classify it into superficial or deep. In superficial, you can just use an antibiotic eye drop, cycloplegic eye drop, or lubricating eye drop, and call the patient the next day. In deep, you can use a bandage contact lens, and you have to also use a steroid eye drop in the very deep cases so that the inflammation is less. Also, be careful in cases of vegetative matter for the use of steroid. So these are cases where you have this iron foreign body removed, whether and this rust ring is there. This can be removed with the help of an alga brush. And these kind of cases where you have this foreign body almost or through and through, almost through and through with the cornea and some traumatic cataract is there. These are best removed under the OR so that if there is any leak, you can do the primary repair at the same time. So foreign body, corneal foreign bodies approximates for almost the second most common type of eye injuries. And there have been cases of well-tolerated wooden foreign bodies also for 40-year duration. This meta-analysis showed that, the high cost of PPEs, lack of compliance, lack of education, hot, humid climate, everything, encounters for the failure of using a PPE at workplace. So we have to educate the patient for the proper protective gear and the need for it. And when the patient comes to you, you can tell the patient that these are needed. Otherwise, they can keep on getting the, foreign bodies in their cornea again and again. With this, I complete my talk. Thanks a lot for listening.